My name's Nicola Prys-Jones. Currently I work as a GP in Heatherview Medical Centre, which is a GP surgery in Poole, Dorset. I also work as a forensic medical examiner. We were based at a Millennium Village project in Bola, which is near Tabora in western Tanzania, and the collaboration was with NESC, so at the time it was NHS Education South Central, and also the United Nations Development Project. And what we did, we weren't working in a hospital just, the main hospital was in Tabora and we were involved in that, but we were also working in the surrounding community in the villages. And the main aims of the project is to develop very poor areas by a combination of health, education, agriculture, infrastructure, and help local people acquire those skills. Emotionally, it was very tough. Life here, even working in medicine, you're quite closeted in some ways from the harsh realities of life. And I mean, anybody knows from looking at the news, working in Africa in general, especially in developing countries, can be quite emotionally draining. But it was really being up close and personal to horrible situations which you couldn't help, and you knew if you were back at home you could easily sort out the problem, but you're not, and you have to do things the way they're done there and using the resources you've got. Getting things done is hard work. People moan about the NHS, but we do have quite a structure. Things out there were much more ad hoc in many respects, and not for everything, but for a lot of things there's sort of tomorrow attitude, which is really hard when you're trying to get things done and you're turning up for meetings, you're turning up to present and no one else is there, and you turn up to get a transport out to the village which is 30 kilometres away and there's no transport, and it's like, well, off you go home, and it's like, well, actually I want to do something today. I think the experience really did develop me as a doctor. Clinically, I've got to examine patients which have conditions we just don't see in the UK, so clinically my skills really did come on. But far more than that, I appreciated how health structures work. In the NHS, you don't really think about where things come from. You get if you want a cannula, you go and get one out the tray. You don't have to think, where's this from? Is there going to be one? They're there. In Tabora, there really wasn't, and we had to think, actually, okay, this person had a contraceptive injection 3 months ago, she needs one today. We haven't got any. Why? And suddenly these questions, became important. And actually, it's really important as someone working in the NHS to know what it is that you're using, why are you using those things as opposed to other things, where are they coming from, how much does it all cost? None of those things had ever crossed my mind. I think I developed confidence, as I said, I developed clinical skills, I developed, I think, leadership skills, the ability to teach people, also recognising differences between people. You do that in the NHS, but you don't always appreciate language barriers, cultural barriers, all of these things on a day-to-day basis, whereas actually we had to work with that out there. And I really became much more aware of working with a wide range of people in a wide range of situations. I would wholeheartedly advocate working abroad and absolutely recommend the experiences that I've had. There was definite highs and lows, but overall just an amazing experience and just brilliant in terms of personal development, but also my career development.